Welcome to another production by the Millennial Mechanical Therapist. Your hosts, Dr. Joseph Gravino and Dr. Clay Case, are two physical therapists trying to treat health issues mechanically. Listen further for patient cases, guest videos, advantages and disadvantages of the way they practice, and much more. Thanks for tuning in today. Check us out on YouTube, Facebook, and at our website. We hope that you learn a lot from watching this video and you come back for more. Hey everyone, I am the Millennial Mechanical Therapist, and today I want to talk about how using the mechanical system of like patient response and things like that is really safe to do. And it's a huge benefit to your daily practice because you inherently, using that system, have to become interested in the patient. Anytime you're going through your assessment, your evaluation, you want to really get to the root of what the problem is. And that sounds pretty like, thanks Captain Obvious on the outset. And I learned that in school and things like that. Well, with everything else we learned in school, that's really easy to kind of lose sight of. We get that huge laundry list of tests and measures that you're supposed to get every exam or eval or things like that. And in school, that's extremely overwhelming. Obviously, with experience, as you keep going through, you find the ones that you find pertinent to your practice and the things that you want to make sure you get through. And then there's some that are maybe not quite as useful. When you're going through that, I really kind of challenge all of my peers and any students that I've had to kind of let those go to the side for a little bit and just listen. Listen to the patient and find out what's going on. So instead of going through, a Hawkins-Kennedy, cranking on them, go, oh, does that hurt? Okay, well, now I'm thinking impingement. Well, how about you kind of find that out through the history in a way? So the example I use with a lot of my patients is, or my students, I should say, not my patients. When I'm going through with students, they'll go, well, this is a shoulder patient. Why aren't we doing Hawkins-Kennedy nears, speeds, empty can, full can, things like that, yada, yada, yada. And I go, well, because they already told me in my history. So when you're going through, if somebody says, I have a lot of trouble reaching up to the top shelf to get plates down. I have a lot of trouble, bringing things up to the side as if I'm going to put my clothes up on the drying rack or on the clothesline, things like that. They already told me these things. I don't have to do these to find out necessarily. Now, from there, you could take that and go, well, that sounds like it would be impingement. That sounds like as they lift, that the head of humerus is kind of rubbing up and just going right into the hook. And then all of a sudden, pinch, ow, impingement, let's try to clear that out. My big challenge that really kind of changes the landscape is let's do exercise and then find out what you feel about that now. So to start with, we'll look at it and go, okay, that hurts today. What's it hurt? Maybe a 4 out of 10. Okay, cool. Let's work with this. Let's do this exercise. You have somebody come up, do a bunch of adductions, maybe horizontal adductions, and then you have them do it again. And you go, does that feel better, worse, the same? And using that patient response builds in the safety of it. So instead of saying, let's do 3 sets of 10 of that, let's go 10 and find out what it does. Now, if it has absolutely no effect and you get that big yellow light, who cares? Let's do some more. We're not doing any damage. We're not doing any harm. Even if it goes ow, ow, ow each time it hurts, well, we're probably not harming anything if lifting up overhead didn't change at all. Now, on the flip side of that, if we go through and ow every time and then all of a sudden at rest they have an ache, this doesn't go up as high anymore, well, we know now. Now you're interested, you want to find out this case. And the good thing to do with mechanical approach, if you're using a mechanical assessment, if this made everything worse, well, let's try out the other direction. Let's do maybe like a pec stretch type idea where you're getting a lot of horizontal abduction as that repeated movement to clear out the joint. And let's find out if that also worsens the presentation or if that completely opposite direction actually improves the presentation. So when you're going through, try to be as interested as you can. I challenge you to do that, not only to benefit your practice and understanding, but for the patient's sake. As soon as you get that buy-in from them, therapy is so much easier. And a lot of times at this point, you get down to the nuts and bolts of what's going on, whereas the previous providers probably didn't have that time. And that's not a knock to any of the practices of any of the physicians or any of the chiros or anybody giving you a referral at this point. It's a unfortunate reality of the medical system that we use, in America at least, at this point. Some of the research shows and some of the statistics show that you're lucky if you get 15 minutes with a physician, regardless of specialty. So in 15 minutes, I don't think I could get too much more information from people than the diagnoses on the scripts that are coming in my door. So for that reason, I really encourage everybody, just be interested. If you're interested in your patients, you're probably 10 times better than anybody else out there. Just listen, really take it to heart, use their language, get down to the bare bones of understanding them and trying to represent, a comforting medical professional to them, rather than somebody who is just trying to put this diagnosis down, get this medication out, do this intervention, and get you going and feeling better. Be interested and become friends with them. That's going to help your buy-in so much, and it helps with the safety throughout the whole assessment if you're listening and you can have that nice open communication between the two. As always, guys, thank you so much for listening in. Let us know what you think. If there's any other tips that you guys find for safety and buy-in, let me know. Comment down below, put it on our website, go on Facebook, let us know. As always, move early, move often, and move to end range, because that is where the magic happens.